Technique of straightening the guide wire using a balloon catheter for successful endoscopic transpapillary gallbladder stenting. A 76-year-old woman with right upper quadrant pain and high fever was admitted to our hospital and diagnosed with segmental adenomyomatosis and acute cholecystitis on the fundus segment of the gallbladder based on computed tomography findings. Considering the high surgical risk owing to her advanced collagen disease, we performed endoscopic transpapillary gallbladder stenting for acute cholecystitis. Herein, we present a case of successful endoscopic transpapillary gallbladder stenting via straightening of the guide wire that looped in the neck of the gallbladder because of segmental adenomyomatosis using a stone retrieval balloon catheter. After bile duct cannulation, a hydrophic guide wire could be advanced into the fundus of the gallbladder. However, the guide wire was largely looped in the neck of the gallbladder due to segmental adenomyomatosis. The hydrophic guide wire was replaced by a conventional guide wire. After exchanging the guide wire, we tried to straighten the looped guide wire. However, it was impossible to perform straightening using the guide wire and cannula manipulation, and the plastic stent could not be placed due to the shortage of the stent length. Hence, the balloon catheter was inserted into the fundus of the gallbladder with loop in the neck of gallbladder. And the balloon was inflated. Then, the catheter was pulled by anchoring the balloon on the narrow part of the adenomyomatosis, thereby successfully straightening the catheter and the guide wire. After straightening the guide wire, a 7 French tapered catheter was inserted into the fundus of gallbladder, and bile suctioning and saline irrigation were performed. Finally, a 5 French 10 cm pigtail plastic stent was successfully placed into the fundus of the gallbladder. After gallbladder stenting, there were no adverse events or pain, and the acute cholecystitis started subsiding immediately. 2 days later, 3 months after gallbladder stenting, the patient has been followed up without recurrence of acute cholecystitis. This schema shows the technique of straightening the guide wire that looped in the neck of the gallbladder using a balloon catheter. In conclusion, this technique of straightening the guide wire using a stone retrieval balloon catheter can be a useful option for successful endoscopic transpapillary gallbladder stenting.